Like your pants. I like your pants. No. They're beautiful.
Henry is not here yet, right? He's appearing remotely. Okay. Okay, Henry's with us. All right, I'd like to call to order the meeting of the Public Safety Committee for September 15th, 2022, and welcome to everybody here and on Zoom. First order of business is public comment, and I have a written comment, and I believe I have one member of the public who'd like to speak to us. I will read in the comment I received in the mail. This is from AJ Kirscher. Hello. This past weekend, I had the unfortunate experience of meeting another mom who recently lost her son, Julian, to fentanyl poisoning in August of this year. Julian was a young member of our community, just shy of 20 years old. This is the sixth local parent that I have met since losing my son, Jared, to fentanyl poisoning last July. According to local data available, we've lost 37 individuals to drug-related deaths from 6/2021 to 7/2022. And so far this year, we averaged 25 calls per month to 911 for overdoses. We know there are significant issues with underreporting of deaths related to overdose and fentanyl poisoning locally and nationally. More and more communities in New York State and across the country are organizing their efforts around this crisis, which is killing people in unacceptable numbers, especially young adults. Tompkins County continues to lose vibrant members of our community. We are failing families through a lack of coordination, communication, resources, education, and prevention. It is my hope that we can organize our efforts locally and work to prevent additional deaths due to overdose/illicit fentanyl. I continue to advocate for a task force with my primary focus directed toward the Public Safety Committee. I will attend the upcoming meeting on October 3rd. It is my hope that the need and establishment of a task force will be an action item at this upcoming meeting. Is there anything that I can do to create a greater sense of urgency on this issue? I am open to participate in any discussion that will facilitate some movement in this direction. Below are the numbers extracted from the medical examiner, which clearly indicates a growing problem. Tompkins County Medical Examiner drug-related death data, 2007, 2, 2008, 8, 2009, 4, 2010, 6, 2011, 15, 2012, 14, 2013, 10, 2014, 15, 2015, 14, 2016, 21, 2017, 22, 2018, 18, 2019, 17, 2020, 19, 2021, 25. Would we be more proactive if we were losing a community member every 2 weeks due to some other related public health issue? Parens, food poisoning, water contamination, even COVID. I realize that there is implicit bias toward individuals who use or abuse substances, but that should not be a deterrent to exploring and deploying initiatives that can and will save lives. I'm hopeful that we can collectively support the urgency to formalize an opioid overdose task force. Willing to do whatever it takes, AJ Kirscher, mom of Jared Brooks, who died of illicit fentanyl, 7/1/2021. And normally we don't respond to privilege of the floor items, but I do want to say the meeting wasn't October 3rd, it's today. And we're here. And I remind the committee that we made a commitment, or I made a commitment on behalf of the committee, I believe it was last April, that we would put this on our agenda for 6 months and see where we were at. And I think that's coming up our October meeting. So we're heading towards our self-imposed deadline. And it's my understanding the Health and Human Services Committee will be getting a recommendation from Frank Krupa, our Director of the Health Department, on this issue of whether we should form an opioid task force. That's their meeting on Monday, the 19th. We also have a guest here, Robert Lynch, and I'd ask him to come to the microphone. Welcome.
Good afternoon. Good afternoon, committee. Robert Lynch, 175 Gray Road, Town of Enfield, member of the Enfield Town Board. And I'm here representing the Enfield Town Board, at least one member of it, namely myself. This afternoon, members of the Emergency Planning and Preparedness Subcommittee of the Tompkins County Council of Governments, otherwise known as TCOG, will present to your Public Safety Committee the outline of a medical rapid response service that the subcommittee requests the county legislature support both in principle and financially. Trumansburg Mayor Roden Hart, on behalf of the subcommittee, briefed TCOG members on this concept at our TCOG meeting on August 25th. Based on the summary information presented at that meeting, I, an Enfield councilperson and our town's TCOG representative, wholeheartedly support this proposal and urge your committee and the full legislature to provide it serious consideration. At the August quarterly meeting between our Enfield town representatives, namely Supervisor Stephanie Redmond and myself, and those of the Enfield Volunteer Fire Company, EVFC officials, although apparently unaware of this latest initiative, expressed the need for a service similar to what the TCOG subcommittee now proposes. We were told that our commercial ambulance provider, Bangs Ambulance, often finds itself overwhelmed by emergency calls. When Bangs' primary backup, namely Trumansburg Ambulance, also becomes unavailable, an ambulance responding to an Enfield emergency must travel from as far away as Dryden. That to me means too much time lost, one or more lives placed in jeopardy unnecessarily. The medical rapid response service, as Mayor Hart described at our TCOG meeting, would provide, in the mayor's words, quote, a fly car model paramedic service that the county would put together to provide mutual aid support for existing ambulance agencies, close quote. We in Enfield need that kind of backup. And frankly, I think this is something that was coincidentally mentioned at our quarterly meeting of the fire company, and I'm glad to see that it is being proposed by Mayor Hart, and I hope you will give it fair consideration either today or in subsequent meetings. And I stand prepared to answer any questions.
Thank you.
Thank you. I can't stay for the entire meeting, but I appreciate your time.
Okay. All right, and next item is, actually, is there anybody else who wishes to address the committee? Seeing none on screen or in the chambers. The next is changes to the agenda, and I would like us to consider moving things around because we're going to have this presentation, and there's some, I think somebody from Dryden can't be here until 4 o'clock. And so I'd like to start that presentation as soon as they are here and move through our other business in the meantime. I don't know if that'll lead to a change in the agenda, but just without objection, that's what I'd like to do. Minutes approval, August 18th, 2022. Could I get a motion to put the minutes on the floor? Travis moves, Veronica seconds. Any questions or comments on the minutes? Did you have something, Mike? Okay. Okay. Travis? I'm calling the vote.
Oh, yes.
Yes. Mike?
Yes.
Veronica?
Yes.
And Henry?
Yes.
And the chair votes yes. So minutes are approved. Sorry about that, Travis. Next up is chair's report. And I would like us to talk about the visit we had to the Shenango County Jail yesterday. Several of us went over there, but I think we can just move that off into the sheriff's report because Derek and Jen were our hosts in going over there, and they can lead that discussion. Other than that, I do not have anything other than the chair's report. County administration, welcome.
Thank you, Rich. I have a number of brief items to update the committee on, and then a resolution for consideration, and also a brief presentation by Mona Lita Smiley. But I'll start with the brief updates. Back on the topic of Executive Order 18, which came from the governor identifying and responding to threats of domestic terrorism. We're expected to submit a plan to the state by December 31st. And we've been meeting regularly internally on this with most, if not all, of the departments that report to this committee, as well as mental health, county administration. And I want to thank everyone, particularly Dominic, the sheriff, and Mike Steitley for their leadership on that, but everyone has been participating. New York State Division of Homeland and Community Services has offered a grant opportunity for counties to apply. It's due tomorrow, and county admin in coordination with the sheriff's office and Department of Emergency Response are finalizing that grant to put in by tomorrow. The thrust of where the state is going with this is wanting localities to form threat assessment management teams to identify early and respond to threats of domestic terrorism. And so we anticipate that will be in the offing for the future. But prior to submitting the plan, we are finalizing a survey of stakeholders, local stakeholders, to understand our threats locally by our community partners, schools, municipalities, our educational institutions, and potential targets. So we will be doing that as well. But so more to come on that, but we're pleased at the progress, and I appreciate everyone's partnership and leadership in that. You had mentioned, Rich, the opioid settlement funds and potential task force, and Frank Krupa, our public health, mental health director, is going to be presenting at Monday's Health and Human Services Committee more on that. We have also, through county administration, have been conducting workplace building safety and security visits and assessments. Bridget Nugent in our office has been convening those, again in partnership with Mike Steitley. The sheriff has participated in some of those facilities, ITS and union representatives, to understand our own workplace threats and building safety. So those have continued. And then finally, I'd like to yield the remainder of my update to Mona Lita, who has some updates on the Community Justice Center work plans, as well as bringing back to you the resolution establishing the CJC Advisory Board.
And welcome, Mona Lita. But before you go, I'm very happy to hear that you've been working on the domestic terrorism issue, and that would be a great subject for a presentation to this committee, I believe, when you're ready. So before it goes out to the governor, maybe you could give us a sneak peek.
Sure. Yeah, absolutely. It's due December 31st, and I would imagine in the coming months we'll be ready.
Good. Mona Lita, welcome.
Hi, thank you. Thank you, everyone. One of the things I'm going to do right now, really super quick before I get to the resolution aspect, is I'd like to talk to everyone about the 2022 and 2023 work plans for the CJC. So I sent this to all legislatures on the 2nd of September. So hopefully everyone has had a chance to look at it, but I'm going to go ahead and share my screen and walk you through what CJC is up to. Okay. we all remember what our charge is. I think one of the most important things is that our CJC contract was signed with the city in August of 2022. So that's pretty exciting. That allows us to start moving forward with some of the collaborative plans that we have. The two documents.
Excuse me,
Go ahead.
Mona, sorry.
Yeah.
The view that we're seeing is not the presentation view. I'm not
Okay, hold
sure.
on. How's that? Is that better?
Yeah,
Slideshow.
or maybe it was. Maybe I was mistaken.
No, this is the slideshow. So is that, can everyone see that okay?
On top of the screen where it shows the multiple slides, there's a little button that says display settings. Yeah, if you click that, you should be able to duplicate. Yeah, there you go.
There,
Ready?
perfect.
There
Thank,
we go.
thanks. Dom.
Thanks, Dom. So the two documents that were provided ahead of time is a copy of okay, my mouse is acting crazy. The 2022 work plan and the 2023 work plan. Not going to read it word for word. I'll just summarize what you're looking at. So for 2022, we talked about the first section is things that have happened each month or each quarter this year with establishing the CJC, working on onboarding for the project director. Back in March, we did some things where we reopened the data analysis search. So those are things that have already been done and accomplished. The graph you're looking at is a sequence chart for 2022 and 23. It gives you an overview of the plans that are to be implemented, like a timeline, tentative timeline, I should say, on when we'd like to kick off all these plans. So that's what all the purple is. It shows when the plans will be kicked off, and that's with the planning groups and identifying stakeholders and members that are going to be a part of those particular plans. So we have here county and city plans. So there's a bigger look right here for 2022. You'll see some of them, like the community healing plan was started earlier this year and then put on pause. So that's why it has a different, key code or color code, I should say. So, if we look at the 2022 county budget items, which this reflects the work that is in plan for the remainder of 2022. So from here on out, there is a reduction in the total ask, just because some of the plans we moved to kick off in 2023 instead of 2022. And then we can refer to the work document for a full cost breakdown, which is in the slides coming up. So there's an updated request for 2022. It talks about what the county share is, which is 50%. The city holds the other 50%. And then what the budgeted amount was for 2022. Some of the highlights for 2022 for the CJC is that it was established, the hiring, and then the building of the community relationships. Another highlight is to re-engage with the community healing plan, and then to provide analysis and reports that will give us an idea and an outlook into the 2022 plans for implementation. So we're looking at a training program, recruitment and retention of officers, and traffic stops and safety as plans to be implemented still. So if we go to the 2023 work plan, it very similar sequence timeline of the different plans and when they're going to get started and get kicked off, and when we have tentative dates for implementation. This is probably a big slide here for county budget items for 2023. So there is not a whole lot of ask for the rest of 2022, just for the simple fact that most of the plans that would require some funding will be asked for the 2023. So if we go down through here, the cost of this one right here, hold on here, sorry about that. The Tompkins alternative response plan, so the Tompkins County Sheriff and the mental health staffing, the co-response model, that cost is for the therapists and the deputies that will be in that particular department. And so then the city is responsible for 19% And so their flat rate is 91,000, and that's to cover one IPD officer to work in that. So you don't see that on here, but it is definitely out there. So the county's total, yes.
Could I jump in with a question? Are all of these items in target?
Over target.
Over target.
These are all over target.
Yes.
So we're going to be voting on each one of these for 23?
Yes.
Okay. All right.
That's correct. They're listed in the 2023 budget as over target requests.
But are they recommended?
Yes,
Okay, so we're not going to see a huge jump in our tax rate.
that's correct.
Okay, that was my inartfully asked question, really. Okay, thanks.
Mhm. There are some other county plans that are not budgeted for. It's way too early in the planning to attach a budget item or amount for them. So for 2023, some of the program highlights is that we're gonna have 10 plan kickoffs. So we'll have 14 total in progress. And then we're gonna localize and expand the community healing plan. The officer wellness training and recruitment will all include law enforcement stakeholder participation. And then we're going to begin the intensive data analysis and reporting. So where we're at with the data analysis hiring is we're waiting for the sign up list and the closeout date for the civil service exam. And then we will look at who is signed up and go from there to create a list. So what's next is that this was presented to Common Council last week. We shared it with them. So it has been made public. We'll be seeking Common Council approval and then release of funds for this from the city, which I believe they voted on. I think we said we were expecting it last week. They did not vote, but it's coming in October. And then I'm going to present to the Tompkins County Legislature and to you guys today. Are there any questions for me?
Thank you, Mona.
Uh-huh.
Does anybody have any questions? I guess I would have a comment. This is an ambitious schedule. I think it's in line with what we've talked about really from the beginning on where we want to try to go. So this is, I think, very good news. Does anybody else? Questions, comments? All right.
Okay.
Okay,
Well,
thank you, Mona.
You're welcome. I think the next item and my last one for today is just to bring us back to the CJC Advisory Board document. It was presented to this group a couple of weeks ago or last month, actually. And then there were some comments on changes that needed to be made. Those changes have been made, so we've resubmitted for a vote today.
Okay, and this is resolution ID 11139, establishing the Tompkins County Community Justice Center Advisory Board. And could I get a motion on that? Veronica moves. Henry seconds. All right, on the floor for discussion. Anybody have comment? Mike?
Resolution just kind of seems like it's missing certain things. Like if you go into the Community Justice Advisory Board Development Committee, it explains like the composition of the board, but that's not in the resolution. So I'm kind of, I wonder how we're going to do that.
Well, in the resolved, it's, it refers to the document. So I think it's picked up there.
Okay.
Does that satisfy your question or?
Okay. Yeah, that should be fine.
Okay, Veronica?
Yeah, thank you. I may have missed something, but I'm a little unclear on the appointment process. It says to people, for people to the advisory board, it says they're appointed jointly by the city and county, but like somewhere else, I think it only mentions the chair of the county legislature to approve vacancies or to yeah. Can someone clarify that? Because I don't know, or correct me if I'm wrong, that we have established processes for the city and county to jointly appoint people to things.
Mona, would you like to speak to that?
Yeah, I mean, my understanding and the way the process was established was that the city was going to appoint, I think they get 7 and then the county gets 7. I don't know. I don't have any recollection of a joint one.
Yeah, that's my understanding as well, because the city has its own process for advisory board appointments, and so does the county. So
Okay, does it say that anywhere?
Yeah, I guess I'm confused now because you have some ex officio members, right? That it's the Ithaca Police Department chief, sheriff, district attorney, assigned counsel, mental health. Well, actually, if you take sheriff, district attorney, and assigned counsel, those are all county. It really isn't 7 and 7, is it? I mean, because you have some people that are going to be on by virtue of their office.
I'm gonna pull up the document. Sorry, hold on.
Sure. It looks like there's 7 people that will be there because of their office. So there's 7 remaining. I mean, I guess the city and the county could jointly pick a mental health representative and somebody from LEAD and somebody from a harm reduction agency. But it looks like even there, that there's been an agency selected to choose from.
I think
Lisa?
you're correct. I thought that the path was more clearly defined, and I'm not entirely clear.
Maybe it
I
should
agree.
be alternating picks, kind of like out on the playground.
But I know you, Travis, you were involved on this subcommittee. Do you recall I don't want to put anybody on the spot. We can, I don't know if each member would have to be jointly approved or if it's one and then the other. It certainly would be more efficient to.
Yeah, Mona, has the city already approved this?
No, they have not.
Well, I would consider an amendment to just say appointments will be made on an alternating basis from the city and the county.
Okay. Okay. Yep, I'm presenting this to them after it was presented to the public safety, so I can definitely make those
If we
adjustments.
pick one, then they pick one.
What about the vacancies?
Well, when a vacancy comes due, it'd be whoever's turn it is, either the city or the county would fill that vacancy. I mean, that's one way to do it. We could do it some other way, but I think that's the simplest that comes to mind.
There's already language in here that says vacancies. The appointing governing body, city or county, will appoint members to fill vacancies on the advisory board created by events other than the normal end of a member's term.
Yeah, I think we have to treat the
So that,
open seats versus the ex officio seats. Because they're different.
that language sounds like it would work well with a process where like certain members are appointed by the county and certain members are appointed by the city.
But then the open members, I don't know how we would do it.
I do believe we figured all of that out before. I don't remember what we decided now. Maybe we get together real quick.
Yeah, I lost the last part of what, I think that's Travis.
It's your mic.
I know we figured this out when we were meeting. Maybe
Mhm.
over the next few days, we can get together, a few of us, just to figure
Yeah.
out what we came up with.
Absolutely, yeah. I'm reading the document, I see things in there, so that's fine, yeah. Why don't we do that and then I can bring it back?
All right.
Certainly, we've identified the issue, and this will go to the whole legislature next Tuesday. And if this could get worked out in the meantime, we just do an amendment and pick it up there, if that makes sense to everybody. Yes? Okay. Any further questions or comments on the document? All right, I will call the roll. Travis,
Yes.
Mike,
Yes.
Veronica,
Yes.
Henry,
Yes.
and the chair votes yes. So there. That's good. Okay. Anything further from county administration?
I think that covers it. Thank you very much.
All right. Derek, welcome.
Hey, Rich, thank you. I was just going through your agenda and for some reason I don't see our written report in there unless I'm missing it. If it's not in there, I apologize. I know Megan helped prepare it and I approved it. It was relatively short. So if it's not in there, I will make sure y'all get that. I'm not sure what happened.
Sheriff,
Yeah.
I just wanted to say that it was submitted after the agenda deadline, but we do have it. So I will forward it to legislators and committee members.
Oh, thank you. I apologize for that. I know Megan has had some pretty severe medical issues with her close relatives, so maybe that impacted how the delay getting to you. So I apologize for that.
No problem.
Yeah, and we can.
Okay, thanks, Rich.
But I guess I don't want to spoiler alert, but is there anything in there that we really should know?
No, I don't think so. It was probably our shortest report of all time. I think it was a whole of 2 pages and a lot of it was the jail stats, which I can tell you off the cuff is today, our inmate count was 47. So we have continued to see a very small increase in our staffing or our inmate counts. But I still don't think it's anything to be much concerned about. I will touch on our jail tour yesterday. We got the opportunity to go to Shenango County and visit their public safety building there. I want to thank Rich and Mike Sigler for attending. Arel also went along with us, and it was myself, Jen Olin, and Ray Bunce from the jail. I know some of the legislators got to see that a few years ago when we toured it then. If you didn't get to see it at all, I think you really missed out on something pretty neat. I know a lot of people have jobs during the day and it was impossible for people to get away to go to that. If there's continued interest in that, I don't mind trying to set up another visit. This time, maybe we can do one in the evening hours if Shenango County can accommodate that, which I'm sure they'd be willing to do. The facility itself is really nice. It's relatively new, although it's been around, I believe, for a decade or so. It's all set up in the pod design that we've had a lot of conversations about over the last few years. And what's nice about it is it gives a lot of ability to be flexible in our classification and how we divide people up, all right within that cell or in that pod. One pod we saw in particular had the ability to separate people 3 different ways based on different classifications, while all in general keeping them within that same pod. So it was pretty neat. Each of them had its own outdoor recreational facility attached to it, its own laundry area. It also had its own program space. And again, all these things are located within each pod itself. It eliminates the need to move inmates, which can always be risky and cause problems. And it also really minimizes the amount of supervision or staffing needed to supervise one of these pods, as opposed to the linear style that we currently still have here in Tompkins County. Throughout the jail, we got to tour the medical facility, which I found myself personally was quite expansive. Very high end, very nice, staffed with nurses, a doctor, multiple exam rooms, its own section completely. Forget what they call it, the control room, how they monitor everything was top notch, very high end again. The whole atmosphere was night and day from what we currently have here, both from an inmate perspective, I feel, and also from a staff perspective. Light-filled rooms, a more housing type style of living, much more comfortable. There was also a staff gym. Just a real nice facility to see. You're spirit was almost kind of lifted walking in there as opposed to walking in our facility, which always seems so dark, dim, and confined, and just an uncomfortable place to be. So again, if there's more interest in going from anybody, I would be more than happy to set up another visit, again, maybe in the evening time. But those that could go and went 3 years ago, thank you for doing that. And I look forward to ongoing discussions. Other than that, that's about all I have. Like Lisa mentioned, we have been working hard on the terrorism executive order response. I think that's going very well. And we just keep continuing to be busy as usual. So thank you.
Yeah, thank you, Sheriff. I don't know if Arel is with us, but I'd love to give Mike a chance to offer any comments he has on our visit yesterday.
Yeah, I mean, I look at it too from a staffing vantage point. I mean, it's hard to recruit, corrections officers in New York State. This would allow us to give them a better working environment, I think. And it would also mean we don't need quite as many people at that one specific place. I mean, everything in this jail was being watched. There was no place to kind of get lost, I guess you would say. And I felt that was the safety of the officers too, was there. And it was just, I mean, this facility still was what, 2006, 2005. So we're talking 17 years, and yet it looked like, maybe not the day that it was built, but pretty close to it for a facility that's running 24 hours a day, 7 days a week. It really is. I mean, sometimes you just have to start fresh and then keep it up. And because it was in this pod, I mean, they had a whole pod that wasn't being used, that if they had overflow, they were able to shut off that pod. So they were able to save money doing that. And then if they have overflow, okay, then they can open it up. But just the way it was laid out was I thought interesting. And certainly the way I've been to other places too. I mean, Onondaga, that was a much rougher jail, I felt. But it was laid out in the pod format as well. That was 60 people per pod. Again, rougher, but still the same kind of concept, and you can see why it works. So no, I was definitely impressed with it.
Yeah, I guess I would offer just the overall feel. The ceiling height is much higher than our jail. And in fact, some of it, it's 2 floors, but it's open. So there's walkways, and they use skylights to bring in a tremendous amount of light. So there just wasn't any area that was dark, at least during the daytime. And then they use chain link fence. So it is all open space, but there are divided areas. So you have some of it that can be dormitory style with bunk beds, and then other areas with individual cells, and you can have further division. So you're really not losing, you can classify and not lose bed space. So you're gaining efficiency there. There's another advantage over a linear jail in that you can use one person to supervise a tremendous number of people. And one of the things I think we should look at from a financial standpoint is, even though a pod, adding one to our jail would be, or two, would be really expensive, the operating costs would likely go down substantially because you can use fewer corrections officers to monitor the inmates. So that you save money on operating, even though you introduce capital cost. And I, as Lisa reminded me, this is not in our current capital plan. So this would be a pretty major amendment to our capital plan if we did something like this. But I think it's worth doing the math and figuring out long-term whether this would be more expensive or less expensive. Certainly, we would get a much more functional jail. I'd also mention, because of on our visit there were a couple other things. We saw the medical facility. Right now we're using a converted cell, a single cell, as our medical facility. And they had something far more organized and I think workable to provide medical care to the inmates. We saw some of their classrooms that they have outside of the pods. So they have the program room in the pod, but then they also have classrooms where they're giving school classes and AA meetings. I'm trying to think what other items we walked through. We walked through their booking area and their Sally port, which is organized a little better than ours and certainly is bigger than ours, in that it's a drive-through rather than something you pull in and then back out of. They have a much larger kitchen, but I'm not sure that's comparable because they're also doing significant Meals on Wheels cooking there as well. Their kitchen is outside of their jail. And I don't know if that makes sense for us because one of the things we have is that's an opportunity for inmates to work is they work in our kitchen, and you can't do that if it's not in the secure space. One other comment I'd make is that the control room was outside of the secure space and ours is inside. And Ray Bunce was telling me, well, there were design choices made back when our jail was built leading to the control room being put inside the secure space. But since then, it's really been decided you do not want your control room within the secure space. You want it outside so that there's no way for anybody to take control of it. So there was a lot to think about from that visit. And I just mentioned, in addition to what Derek said, we could certainly go back to Shenango. At our county picnic, I met a sergeant from Seneca County, and they apparently have a pod system, and he was very forthcoming in saying you're clearly invited to go there as well. So we could certainly go back to Shenango, we could see Seneca, but I think it is worth something for the legislators who have not done a jail tour in a modern functional jail to really see one. I'll stop talking. Annie.
Thanks, Rich. Yeah, I went on the tour a couple of years ago. We went to several facilities, and I concur with my bar for life for all reasons.
We're having trouble understanding you, Ann.
Hold on a second.
We had a question from Matt in the chat asking if we know what the jail population numbers are for Shenango County.
Yeah, the jail size, I think, was 161, and they had 91 in-house while we were there. A much bigger jail than ours. And I wouldn't think we'd need something that size. But, yeah.
You know, to look at it from the outside, you wouldn't know that.
Yeah, it's built on a hill, so you really don't see it directly. And they had 5 pods, I think. So, it's broken down into smaller sort of units. Ann, you want to try again?
Yeah, is it better now?
It is.
Okay, yeah, sorry, I was using an external speaker. So I concur with everything that was said. In addition, I just wanted to add that after I took the tour of several facilities that the sheriff and undersheriff took us on a couple of years ago, the only things I would add would be that it's not just a better place to work, but and maybe this was said, it's a safer place for our employees. And so yes, we'd be able to attract and maybe retain people. And also for people who are LGBTQ, it's a much safer and appropriate way to provide the housing when they are detained. So I would definitely look at figuring out if we could somehow get to a pod system. It's just something. Also, the way the modernity of the building too is there are just built-in safety things that we just don't have, and because of the era that our jail was built. So it would be much safer that people would be less opportunity to harm themselves or other people.
Anybody else? Mike.
I just wanted to mention one other thing. I mean, say we were to take the current jail and make that into the administration part, right? And the non-secure part. And then we were to add 2 pods to it. I just want to prepare people. That's going to be expensive. I mean, no matter what we do here, it's going to be expensive. Jails are just expensive. Walking through the jail, people always wonder why. And I'm just trying to prepare people for this because they wonder, well, why is a jail so expensive? you walk in, you look at the screws, for example. There's not a screw in there that you can take out with a coin, for example. Even the way that the tables are made, you can't take apart a table and make a weapon. Everything is kind of like that. And I don't want people thinking that, oh, this is like the Taj Mahal of jails. No, it's just jails are just expensive. I mean, I've been in Elmira Correctional, for example, and that's a state prison. You don't want to be there. And not just because you lose your freedom. It's unpleasant. I mean, it's dirty, it's old. This jail was clean, and the biggest thing you lose is your privacy, I would say, in that jail. And for good reason, right? You don't want to lose control of the jail, basically. But even with visitation, yes, there's a way to touch your family member's hand or whatever, but it's all very closely monitored. And yeah, it's not a place I'm looking at it going, man, I don't want to be here. And that's just for a jail that we're supposed to keep, either people just a holding facility. So I just want to prepare the public that, yeah, I mean, this will be expensive regardless of what we do, and just prepare for that. And the pod system really did seem to meet a lot of the needs that we would have going forward. So
I certainly agree with you. I think this jail, the block on the outside said 2005, and I had asked what that cost, and our guide, she said she thought 35 million in 2005 dollars. So that's for the whole facility. I mean, it had to say, for example, a beautiful set of locker rooms and a gym for the road patrol and the jail personnel to use. So there's more here than if we just added a pod. We could probably do it at a lower cost. And I'm thinking it might be possible to add a pod to our existing facility, so we wouldn't lose secure space, but we'd add to it. And perhaps we'd take out some of the secure space to add to road patrol area. But there might be a way to do this at a somewhat lower cost and gain, say, use the existing space for classrooms, for medical facility, for expanded storage, evidence for the CAP court. At any rate, there's a lot to think about here. Henry.
Yes, Derek, what's the process for getting rid of or right-sizing correctional officers in the jail?
Are you asking, Henry, if we were to have a different jail style, how we would determine staffing? Yeah, that would currently still be in consultation with the Commission of Corrections. The problem we have now with the linear style is they require us to have certain posts along the hallways. If you remember how, from the last time you were here, and that causes COs to have to cover larger areas physically, so they have to get up and walk around and move around. So yeah, it would still be up to the commission, but I can tell you, looking at the pods, and I believe you were with us last time we went, I think.
Yeah. Yes, I was.
So you remember, the number of inmates one CO can supervise in a pod system is much, much greater. So that would all be given in consideration with the design of the jail and our ability to limit inmate movement, which would also reduce staff. So we would just have to do what we've been doing right along, design these architectural plans along with the Commission of Corrections input and just determine staffing that way.
Do you know whether the commission has reduced other jails that have changed in terms of correctional facilities, correctional officers?
Yeah, I wouldn't be comfortable commenting on that, Henry, only because this pod system has been around for a while. I think we're the last probably linear style jail in the state, I believe.
Oh, really?
Yeah. And so I wasn't part of any of the processes going through that transition with other jails. So without talking to them further, I wouldn't be able to say.
Okay, thanks.
Yeah, and just to be clear, this would be, if we went forward, it would be years. And I
Right.
anticipate we would not be, we could deal with any issues in changing staffing levels through attrition or reassignment. We need corrections officers right now. We're not where we need to be. So we're hiring. I don't want to lead anybody in the wrong direction there. Okay. Anything further for the Sheriff's Department? More to come on that issue. Let's move on to the District Attorney. Welcome. I see Matt is with us.
Thanks, Rich. Couple of things really quick. Last night, I was able to meet for the first time with the City of Ithaca Reimagining, the Ithaca Police Department subcommittee in City Hall. And I think we had a productive conversation. Both I and Acting Chief Jolie spoke to the subcommittee last night. So that was my first engagement. And I think it was Chief Jolie's first engagement with that subcommittee and with that specific part of the Reimagining Public Safety process for the whole county. So I'm encouraged that now I'm starting to become involved with that. In addition, we are continuing to meet with the data publication group related to the publication of the DA's office and the assigned counsel office's data. And we have a meeting, a Zoom meeting tomorrow afternoon to further that process. Otherwise, we've got a couple trials coming up. We got a few trials between now and the end of the year. So the jail numbers are a little higher than normal, as Derek mentioned. And I think that's a result of a spike in some violent crimes that have happened. They're all unrelated to each other, but still crimes that are bail eligible and have resulted in people being detained pre-trial in some instances. So that's just a natural ebb and flow of the system.
I'm very happy, Matt, to hear that you attended that meeting and that seems to be on the right track. Yeah. Okay, any questions or comments for our district attorney? Okay, well, thank you, Matt. That was crisp, as we like to say here. And next up, Dan Cornell is with us. Welcome, Dan, from Probation and Community Justice.
Thank you. Hello, everyone. Like everyone else, it seems like we've got a lot going on right now. We're working with Department of Emergency Response on a plan to implement, hopefully in the next couple of weeks, October target of having portable radios for all of our probation officers who are going out into the field to do field checks. This will replace our current model of sending text messages to your supervisor when you go in and out of a residence. Will kind of bring us into the 21st century and include us on the CAD system. So Mike and Jessica, their team at Department of Emergency Response has been fantastic in helping us develop this plan. I also appreciate the sheriff allowing us to have access to the Sheriff's Department radio frequency, as well as Jen for providing me with some assistance in developing policies and procedures. So we're on our way to being able to have a real enhanced safety for probation officers out in the field, being able to check in and out of field contacts through Department of Emergency Response.
Dan, if I could ask, is that the ES chat system or is it a Motorola type radio?
These will be portable Motorola type radios that the officers have in the field, and there'll also be, I believe, 5 ES chat capable devices here for that supervisors will have to be able to monitor what's going on the radios, but they'll utilize their cell phones to do that. We're trying to do this the most cost-effective way. We have not purchased radios. They're actually on loan. Mike was able to get us some radios to use. We're intending this to be a pilot to see how it works out. And if it's as effective as we hope it will be, potentially be asking for money in our budget at a later date to actually purchase newer radios. going to be meeting next Thursday with Department of Emergency Response and our full staff team to sort of go over the protocols and expectations and get some things more firmed up in that regard. I don't know if folks have questions about that before I move on to other things.
Any questions? Oh, keep going.
Okay. I wanted to let folks know the dump and run sale, which is almost exclusively staffed by our community service work project supervisors and community service clients, along with some assistance from other not-for-profits. Held the dump and run sale in August. They took in $83,000 in sales for items that would have been thrown away or just disposed of. It's $13,000 more than they've ever made in the past. All that money will go towards helping the community. It fully supports the Cops, Kids, and Toys program and other not-for-profit agencies in the community. So really happy to have that under our belt. It was a huge success, and they learned a lot this year. Every year they do it, they learn better methods of presenting things for sale and weeding out the things that don't sell. And it was a huge success. Unfortunately, one of my guys recently was injured and now is not going to be able to work for a little while. Broke his hip getting tossed from a horse on his own time. So we're down to one work project supervisor. At the same time that we're increasing the numbers of people in the community service, we started a pilot project with that as well, where we're recommending either 24 hours or 40 hours of community service for almost everyone who's sentenced to probation. Be 24 hours for a misdemeanor and 40 for a felony. I really think it enhances our use of restorative justice principles and, teaching people skills while they're also giving back to the community as part of their rehabilitative process. So we're starting to get some more numbers in for that. Also, yes.
I did have a question on that. I think that's very good news, and I agree with that principle. How do you get projects? Is there a vetting process for eligible community projects?
They have to be for not-for-profits. Basically, people call and they'll propose things to us and we'll take them on as we can. We recently partnered with veterans, with J.R. Claiborne and the Vietnam Veterans Association. We're going to take over a weekly cleaning of the war memorials in DeWitt Park. That's been done by the Vietnam Veterans Association for a while. That group is shrinking as they age out, so we're happy to assist them in maintaining those monuments, keeping that area clean and user friendly.
But there's more available projects than you have people, yes. So you're short for work to do.
Absolutely, we have big projects that occur annually and sort of have their sort of time slots. Friends of the Library is a big project that we do, Cops, Kids, and Toys, the dump and run sale. They also have some cemeteries that they take care of. They've taken on some trail cleaning and maintenance for a wildlife conservatory out in Caroline. But we definitely have the ability to take on additional projects. We're taking care of some, trying to keep the radio transmission towers accessible and cleaned up for Department of Emergency Response. So smaller projects, I'd say we have time to look at and potentially take on, but we do have some big ones that we need to do on a routine basis that we'd hate to give up, because it's a cost savings to the taxpayer that we're providing a service that would otherwise have to be contracted with a provider, or a private provider.
Okay.
Other than that, I mean, we're participating in the terrorism meetings or anti-terrorism meetings. We're participating in human services, building safety meetings, and I could fill my week with 40 hours of meetings if I wanted to. We're trying to keep our hands everywhere that we need to be without engaging in any mission creep. So
Okay,
we're busy.
well, good. And thank you for the report. Any questions or comments for probation? I think we're good. Thank you, Dan. And I see several people here, I think, for the presentation on the ambulance service, but I'm wondering, should we get assigned counsel done? I don't see Lance with us. So I think let's go to Department of Emergency Response. Welcome, Michael.
Thank you, Rich. Just before we get into the presentation, there's just a few things I'd like to highlight in our TomStat report that would only take a minute. The first thing I want to do is just recognize Harlan McEwen. He still serves as a volunteer member of the DOOR team, and he was recently recognized by the Association of Public Safety Communication Officials for 50 years of service, which is quite remarkable. And also John Halachek was recently recognized as serving as chair as the agency training program committee chair, which has an impact internationally because that was really part of the International Association of Public Safety Communication Officials. And I'm proud of both of these, both of our team members for their recognition. And just to kind of highlight what the significance of John's role. John, our 911 center communication manager, is helping to establish best practices internationally when it comes to training standards for 911 centers. So I think that's quite an honor. And Rich, just one thing I would follow up for something you've helped us out a little bit with. We received word just today that we were able to wrap up the AVL issue that we're having now with IPD, and the vehicles are back online. And that was through, again, your assistance, the cooperation of IPD and their IT and our IT working together to help us get there. So it took a little time, but we got there, and I received word today.
I am so happy to hear that, Michael. That is just great. And just for anybody who didn't understand that, the emergency dispatch is able to see the location of any emergency vehicle. And there was a computer, application software glitch that they could not see the city police vehicles. And this has been a long running issue to try to clear this up and get them reconnected. And fortunately, as Michael just indicated, we got there. So that's a good safety thing for those officers. So thanks for reporting on that. And I agree with you for John Halachek and Chief McEwen. They've really done great work in our community.
Absolutely. So as you know, we're here today also to give a brief presentation on the state of EMS in Tompkins County. And I'm going to turn it over now to Mayor Hart, who will be presenting, and I'll be assisting with the slides. So I'll be sharing now.
Thanks, Mike. Appreciate it. And thank you to the members of the Public Safety Committee for having us on. I will try to be concise, but this, as you can imagine, is a fairly expansive topic. I'm going to begin by working through a presentation that was put together by a student-led group at the Cornell Institute of Public Affairs earlier this spring. As some of you may be familiar, there was a study done back, and I believe it was 2016, which kind of looked at the state of EMS services throughout the county, and there were some recommendations that were generated from that. And then there's, of course, been lots of talk and concern over the many years since as to how do we continue to make sure that emergency services are adequately provided throughout the county. The topic of volunteerism is, of course, always a big one. Your current colleague, Lee Shirtliff, Mike's predecessor, certainly did a lot of great work on that topic. So fast forward to 2021, 2022, this project was done, and this is not the entirety of the report. We kind of cherry picked the most relevant slides so that we could be respectful of everyone's time. But kind of as a broad overview for folks maybe newer to the topic, there are essentially 4 basic models when it comes to providing ambulance service. You have the private model, such as Bangs. You have the municipal model, such as Dryden Ambulance or Trumansburg EMS. You have not-for-profit models, of which I don't believe we have any very close by. There's some in Onondaga County. Jason Molino, actually, when he was out in Batavia, he helped set up a not-for-profit ambulance model several years ago. And then we also have a hospital-driven model where the hospital itself owns the ambulance company. We've seen that in parts of the state like Chautauqua County, areas around Buffalo. And each of these models has their pros and cons. And I'll just touch on them very, very briefly. You know, private company, the obvious advantage is there's no taxpayer dollars being spent. The burden on local government doesn't exist. The disadvantage is you're not going to get a private entity to run an ambulance service where they don't have the call volume necessary to turn a profit. Just by way of example, about 15 years ago, Trumansburg looked to Bangs and asked them whether it would be possible perhaps for them to take over management of ambulance service in our area. And the answer was, we're sorry, but you don't have the call volume to make it worthwhile for us. So that's one version. The municipal model is, as I mentioned, Dryden and Trumansburg. You have taxpayer dollars funding a service. Some of that cost of service can be recouped through billing, but primarily it is taxpayer driven. If you could just go back one slide, Mike. The nonprofit model, as I mentioned, relies heavily on grant funding and donations. And then I touched on the hospital model. One big concern with the hospital model that I'll mention is that the reimbursement rates from insurance companies for what are called inter-hospital critical care transports are very high. So you've begun to see hospitals dedicate more and more of their resources on the ambulance side to doing that, which means there are frankly less ambulances available for emergency calls in that district. And that's what happened out in the Jamestown area, Chautauqua County. And so Chautauqua County itself has recently moved to a county-run ambulance service to fill in those holes. The next couple of slides basically show response times, and I don't want everyone to get eyes to glaze over, but there's kind of a football season. There's kind of a coach's clicker version of this. This is from 2017. The next slide is 2021. And what you'll notice if we go back and forth just a couple of times is in 2017, the southern part of the county, Slaterville, Speedsville, Brookendale, had some of the longest response times in the county. In 2016 or 17, Slaterville Volunteer Ambulance Company closed their doors, and there at that point was no ambulance service local to that area. So Bangs Ambulance was required to begin picking up some of those calls. And the result was, on the next slide, you'll see that the response times in those areas improved. And as best we can tell, the reason why is because Bangs was reliable, whereas previously the floundering Slaterville Ambulance Company, though they did their best, was simply not able to produce the manpower to generate the coverage that they wanted. However, as Bangs's resources were pulled to the southern part of the county, response times in the rest of the county, if we go back one slide, Mike, and look at the right side of the screen, the Newfield and Enfield averages, to Bob Lynch's point from earlier, fast forward 4 years to 2021, we've seen significant increase, 10 minutes, nearly 100% increase in response time, primarily because of resources being pulled further south. And if we imagine, emergency services don't exist in a silo. It's an interconnected network of agencies relying on each other for surge capacity, as we call it, for interagency support, so that when the network is strained, other agencies can fill in. But that does mean, unless we increase staffing somewhere, that those resources are spread increasingly thin. So we looked at all of this data. The Cornell Institute for Public Affairs folks looked at all of this data, generated some recommendations. And these next couple of slides, kind of very, very briefly describe what some of their recommendations were, which we have then taken and crafted something that I think will work for the county. And I'll just go through the next couple of slides, Mike, in terms of what those recommendations are. The recommendations essentially look at what can the county do, what should the state do. And I'll pause 1 second to hover on this slide with a map. The slide with the map, and this is not a Trumansburg-centric conversation, but it's the district I know best. You can't see the village of Trumansburg on that map. It's in the middle underneath all those calls. However, where you see all of those geolocation pins, those are calls that we have taken. Our EMS department has taken between June of 21 and May of 22. So it's 1 year worth of calls. Our contracted district is a tiny portion of that, and we're taking calls all up and down the Finger Lakes. And there is a cluster you'll notice in the town and the city of Ithaca. That is a new phenomenon. We are taking calls in the town and the city at a rate that we simply have never done before. And so this illustrates kind of the stretched, if you think of a rubber band, the stretched nature of the emergency response network and the need for some support. So what does that support look like? Well, from the county level, the student-led group came up with some ideas. One is better interagency coordination. And I want to thank Mike Sigler in particular. When he first came on, I think he might have been on the job only a couple of weeks. He was already reaching out to all of the ambulance and EMS agencies and saying, what can we do to improve interagency coordination to make sure we, meaning the county and county dispatch, has a good idea of what your staffing levels are at any given moment, so we can know where to best pull resources should we have a large scale event or simply a large number of calls at any one time. There's also some conversation we've had about things the county can do to assist with certification, assist with training, assist with the kind of the medical side of the process. We also have recommendations that as to what the state can do. I've been having close conversations for many months now with Assemblymember Kellis. She and I are working closely. I had a meeting Tuesday with Senator Hinchy. She's not our state senator, but she has as a personal mission of hers an improvement in EMS service statewide. It's a key both campaign and legislative issue for her. And so we had a great meeting on Tuesday, and I'll be working closely with Senator Hinchy and Assemblymember Kellis. And what the state is looking to do, and this is kind of an FYI for all of you on the legislature, what the state legislators, and there's a tremendous amount of support in both chambers, they are looking at ways to mandate EMS service across the state. Currently, there is no mandate for any of us to provide ambulance service. They are looking to make it mandatory in some fashion. They are looking to also, part of what I've been working with Assemblymember Kellis on most closely, is create a funding model that will allow Albany to help subsidize EMS services, probably at the county level. I don't know if it will get down to the town and village level, but we're talking in the hundreds of millions of dollars, CHIPS style subsidy where, if you have highway, you get CHIPS dollars. Well, if you have EMS or contract for it, you get some state aid. And that's all. And I thank Assemblymember Kellis, your former colleague, and certainly Senator Hinchy. This is a recognition on their part that EMS is not just emergency response. EMS is healthcare. If we understand the fact that EMS is part of our frontline medical system, COVID certainly shined a bright light on that when folks couldn't get in to see their doctor, and it was difficult to get to an emergency room outside of riding in an ambulance to get to one. These paramedics are frontline medical professionals. Ambulances are mobile emergency rooms, and they should be supported as such. So that kind of brings us to kind of on the ground today. Where are we? I've had conversations with Megan Bangs as well as Tim Bangs at Bangs Ambulance. What is the state or status of being able to make sure that the ambulance gets where it needs to go in as short a period of time as possible, and the interconnected nature primarily between Bangs, Dryden Ambulance, and Trumansburg EMS, given that Dryden and Trumansburg have regional responsibilities as well. And what we've come up to, and certainly jump in any time, Mike, to clarify the nuts and bolts of it. But what we would like to concretely propose to you all and look for support from the legislature is that Tompkins County look to create, under the auspices of DOER, a rapid response model, which is not looking to in any way take over area of coverage from any of the existing ambulance companies. It's not looking to get into the traditional transport ambulance business, but it's looking to augment and support the existing agencies by having the county operate the fly car model. The fly car model essentially is, think of an SUV with advanced life support equipment on board, staffed by paramedics. And so if there is a call in Enfield, we'll pick on Enfield because of Bob's statement earlier, if there's a call in Enfield and Bangs is not available and the village of Trumansburg isn't available, either because we're responding into the city of Ithaca or maybe we are somewhere in northern Seneca County, at least we can get a medical professional to the scene as quickly as possible. And then you still are in a position of needing to wait for the ambulance if a transport is necessary, but you've decreased response times in a medical emergency to the resident. And at the end of the day, when it comes to EMS services, you know, getting medical personnel to the resident as quickly as possible is really our primary responsibility, I feel. And so how that looks, how quickly it takes to set up, you know, that's part of the discussion that we want to initiate with you all. But the notion of having the county have the capacity to provide support when there is a surge in calls, or, you know, God forbid, if there is a large scale incident of some kind where multiple agencies are required to be in one location, there would be that so-called surge capacity available coming from the county, rather than simply relying on this interconnected network that is, quite frankly, stretched pretty thin at the moment. And so with that, I'll hand it back to Mike if there's anything that I've missed. But I certainly do want to field any questions that any of you all might have with respect to this.
Thank you, Mayor Hart. And Michael, I'm sure you have comment, but if you could do us a favor and introduce the other guests that are here on this issue, because I see several, but I don't want to miss anybody.
Absolutely. So we have Mark Whitmer here today, Ben Carver, Dan Lamb, and somebody who is not traditionally on the call from Doer, Justin Lamb, who serves as our emergency services coordinator. And one of Justin's primary responsibility is to serve as a liaison between our department and the other emergency services, particularly fire and EMS.
Did you want to add to that, Michael, or do you want to just open the discussion?
Sure, I would absolutely like to add to it a little bit. So as most of you know, I've been here about a year. And one thing that I'll say is that I think that we're very fortunate to have the type of EMS network that we do have here in Tompkins County. If you're not aware of it, many of our surrounding counties are really struggling with EMS, and some of them are desperately struggling with EMS. Tioga County recently commissioned a study, and that study, the results of that study were just released a few weeks ago. And Sigler County right now is in the process of developing a countywide EMS system. What I like about the approach that Mayor Hart laid out and what we've talked about in the TCOG EMS subcommittee is about augmenting the great services that we already have and not looking to replace the services. What we need to do is just figure out a way of being able to get advanced life support to some of our most critical patients in their greatest time of need. And with some of the response times that we have, even the use of a defibrillator would not be beneficial if we can't get it there in a timely fashion. So I definitely think that there's a lot of opportunity for discussion, but I think that that the way it was described certainly, I think, represents filling a gap that we have here in Tompkins County. And I'd love to hear from the rest of the subcommittee, of which I'm the junior member of. And I would also like to add that I am grateful that they invited me to the conversation and allowed me to weigh in and offer suggestions. Thank you.
Great. Mark, is there anything you wanted to share with us? You're muted.
Great. Thank you, Rich. And thanks for having us today. I just will, in 2020, this subcommittee of TCOG was formed, and so I chaired that subcommittee, and I've been really fortunate and grateful to have the membership, the committee members that know a lot about this issue and have stepped up to really help us steadily discuss and move forward with developing a plan that Rorden really so nicely just summarized. So I want to thank Mike and Justin, and early on Jessica joined us from DOER, and then Dan Lamb from Dryden and Rorden. It's been really great. So I just want to say thank you, and yeah, I hope we can. I think we're really excited to. This has been a long-standing problem, and Rorden highlighted when I became supervisor in Caroline, that was right after we lost the Slaterville ambulance, and so this has been an issue. It's all over rural New York with the loss of volunteers. So I'm heartened to be making what I feel like is progress on an identifiable plan to address the issue. So.
Okay, thank you. Ben, is there anything you wanted to share?
No, thank you for the opportunity. I'll just quickly say, I was part of that team that Rorden mentioned at Cornell, and also deputy mayor and EMS commissioner in Trumansburg. So it's an issue that I think is incredibly important, and I think if anything is more acute in terms of need since that report was commissioned. So I think if we could redo the response time, that survey just over the last year, I think you would see significant changes and not really for the better. But I'll leave it there. I think Rorden and Mike have done a great job of summarizing our findings and recommendations, but thank you all for having me.
Okay, thank you. And Dan.
Yeah, thanks everyone, and good afternoon. I was teaching a class just downstairs until 4 o'clock, so I missed the earlier portion of this meeting. But I come into this wearing a couple hats. One being a Town of Dryden official deputy supervisor, where we doubled our ambulance tax in 2019, and that left a mark. I didn't like doing that as a legislator at the town level. And joining this TCOG committee allowed me to bring in that perspective, along with Rorden's perspective and the others, to focus on this issue and to look at our networks and our resources and think about how we could work on this. And so I took the opportunity to organize a research team that Ben was part of through one of my other courses, and we did some good outreach and research through that. Establishing connections with state legislators, including Senator Hinchey, who I've known since she was 4 years old. And we were able to work well with her, and her passion for rural ambulance is really strong. As many of you know, we now have the standing rural ambulance service task force in the New York State Legislature, and that's a big deal. And so the report came out of that, and I appreciate Rorden's participation in making that a really strong report. But one of the recommendations that came out of this was a fly car, or we can make the case for that, and it's not a radical idea. I just want to put that out there. Other counties have done this in New York. Most recently, Madison County this year established a fly car system to fill the void, and we just asked you guys to give it some thought. It's not in my town, we're paying a price, we're getting the ambulance service, we're covered, but I know there's some other towns that haven't made that choice to invest so much, or maybe they don't have the resources or the ambulance services to promote anyway. We've got Dryden Ambulance, and we're kind of lucky that way, but we do pay for it. And I just think if it hasn't become clear yet, we've got a patchwork system here for an essential service. And that's why we look to the county as a entity that could provide more consistent, or at least try and fill some of the gaps that we have in this system. Thanks.
Thank you. And I see, Mike, you have a comment.
I have like 3 questions.
Yes, please jump in.
Are we at the questions?
We were at the question point.
So I'm just going to ask all 3 questions, kind of going through. Rorden had mentioned about frequent flyers. When I was up at 911 taking a tour, I mean, one of the calls that came in was somebody that, 3 times a week they're calling. Was there any recommendation on how to cut that down? it's one thing to say, oh, it would be great if these people didn't keep calling us. I mean, they're obviously calling you for a reason. I didn't know how to do that.
A great question, Mike, and that is the question. When someone dials 911, county dispatch is required at this point to dispatch either a law enforcement officer, a firefighter, or an ambulance service. That's basically the three versions of what can come out of a 911 call, or some combination of the three. So reducing frequent flyers, that's something that we would have to work closely with DOER to try to come up with a recommendation. Probably involves looping in mental health services in some fashion, DSS. That type of policy and procedure, frankly, doesn't exist in New York State. So we would be breaking ground in trying to figure out how to manage that, because a lot of the times, like, again, speaking for Trumansburg EMS, because I know it best, a lot of our frequent flyers occasionally need an ambulance. So we can't necessarily dismiss the call, but there should be some way that we can, at the dispatch level, it can't be done at the agency level or at the local municipal level. At the dispatch level, better determine what resource they might need on that particular call. That would really be the only way to really make a dent in that.
Okay.
May I also just address that as well, Mike, please?
Yes.
So I also think that this is a good example where wraparound health comes into play. And I also think that this could be part of the larger discussion about reimagining public safety. Because if we could get a first responder there, Mike, for example, in a fly car before an ambulance gets there, number one, that trained clinician can decide exactly what resources that patient needs. And maybe it's at that level where we're starting to call out some of these other resources that we're talking about at a reimagining level, as opposed to maybe tying up an ambulance. So I think that by having somebody there who can actually speak with the patient, that has the training to recognize the type of medical emergency they have, and even use it as a coaching opportunity, that in itself might help reduce some of those frequent flyers, because that is a challenge for us to do at the 911 center level. Thank you.
Okay, before you go further, I saw Lance had something in the chat, but we can't read it.
Sure.
Lance, do you want to share your chat comment?
Sure, Rich. Sure, Rich. Sorry, everyone. I just noted there, I mean, because I suspect there are categories of these frequent flyers, but I know from personal experience, I mean, one of the ones that can be difficult or challenging are oftentimes when you get people, elderly particularly, who are beginning to deal with dementia issues or decline, will frequently call thinking they need assistance, and it tends to be turns out to be medically kind of a nutty burger, but they become calling, we've dealt with that where they're calling multiple times a week, where they may live with family, but family's gone. So they just call the ambulance and,
okay. Yeah. Easy to identify the problem, very hard to solve. But okay, let's keep going.
My
Mike?
second question kind of dovetails off of what Mike just said. So when I was an EMT, a lot of the calls were just for like a transport. It wasn't even like an emergency. I mean, I guess it would come in as an emergency call, but it was really just to transport somebody to the hospital. Do we have something in place for that now, or are our ambulance services kind of still doing that? I mean, that was 20 years ago. So.
No, actually, it's a great question, Mike. And the answer is most of the time our ambulance services are still doing that. And I think that that's another benefit of having some form of rapid medical response, because again, getting somebody there that really would be pretty much the highest level of care that we can offer in a pre-hospital environment to really assess what that patient's needs are. We can maybe now limit the amount of times an ambulance is needed to go to a house to do the same thing and realize they're maybe not necessary. And I think part of the broader picture, again, is to look at other services that we can incorporate into this model that maybe could do some of those more non-emergency transports, so we don't need to tie up an ambulance with that task.
Okay.
And you had a third question.
Which refers to the fly car. And this may be too early to answer this question, where would people envision this fly car being out of? Would it be a county service under Dewar? Would it be, maybe we fund Bangs to do this, or do we fund maybe Trumansburg to, is it too early for that question? Like, where do we envision this kind of fitting?
Anybody?
I don't think it's too early to start asking that question. I will say, and I hope I don't get myself in trouble for this, out of the conversation on Tuesday with Senator Hinchy, one of the more elegant solutions to how an essential service becomes mandated, because the question was raised, there's nothing in state law that uses the phrase essential service. So why is law enforcement mandated? Why is fire mandated? Well, frankly, you have an elected sheriff, therefore it's mandated. It's a statutory function. Same thing with fire. Towns are required to provide fire protection. So it's a statutory function. And so what the senator and Assemblymember Kellis are looking to do is create statutory requirements around the need for EMS. And the easiest way for Albany to, as you well know, generate a statutory requirement is to make the county do it. And so I think that within that subset, there will be room for a county to contract with another agency to make sure it's provided. On the other hand, to Mike's point from earlier, we have agencies in Tompkins County. There are a lot of counties in New York State that are really, really thin on ambulance service at all. We have 3 fantastic agencies, and I'm not patting myself on the back, it pre-exists me. Trumansburg EMS, Dryden Ambulance, and Bangs are 3 fantastic emergency services agencies. Bangs is now 3rd generation. There isn't a need to try to do anything to change that structure. It's more just, how do we support this existing structure when they are stretched thin? And I think that's a county role. I don't think even throwing money at one of the existing agencies and saying, here, staff yourselves much more, I don't know if that is quite as elegant a solution as having the county available to step into that role as needed.
Okay.
And if I may, I'd just like to add Groton as well. Groton has an ambulance as well.
Okay. I have some thoughts and comments, but I'd like to give other committee members a chance first. Anybody? Yeah, Veronica?
Thank you all for all this. I guess this is just briefly reflecting to see if I'm understanding a piece. It sounds like one important conceptual shift behind this is right now EMS, ambulances they offer on-site come to you life-saving medical care, and they also offer transportation to the hospital. And one of the things is, what if we split those into 2 separate things? Right. So the medical care that comes to you but doesn't drive you anywhere, and maybe Mike was saying, transportation to a hospital that isn't also outfitted with intense medical care.
Yeah, I think that's a good understanding, basically, of what we're suggesting. I think the fly car model doesn't necessarily look to separate the 2 in any type of permanent way. It's simply an acknowledgement of the need for the medical professional at the scene as quickly as possible. Statistically, the AMA and others will tell you that the greatest determining factor in the survivability of certain events, such as stroke and heart attack, is how quickly a medical professional gets to the patient. And so the transport function is certainly going to continue to be an important piece. But if we not only are able to triage some of these calls so that we don't need the transport if it's not necessary, but also get the medical provider to the patient as quickly as possible when it is necessary, we're just beefing up the entire system in a way that doesn't require, the county to spend, I think I did some back of the napkin math, $8 million to stand up a brand new ambulance agency with capacity for the entire county. We shortcut that kind of giant need in favor of simply supporting what exists and filling in the gaps when those cracks appear.
Hey, Henry.
Do we know from other counties how quickly the fly car model will work in Tompkins County? What are the response times?
I don't have hard data for you. I do know there was a recent news article I did read out of Jamestown due to Chautauqua County standing up a full ambulance service, but fly car driven with transport coming later if necessary kind of concept. And because they essentially, due to the way the hospitals were operating out there, they had very long response times. You know, they were able to cut response times down into the high single digit, low double digit minutes. So they were able to get to the, 9 to 15 minute range, which frankly is where most of the county is here, except when we have surge type events or kind of overload of the system. So, national averages run anywhere from, in urban areas, you're in the 3 to 6 minute range. If you're in a very rural area out in Montana, it might be a day. So we're certainly at the better end of that particular scale, but it's just a recognition of the stresses on the system, which have frankly been increasing, and how can we get ahead of that so we don't end up in a situation where there's a real lack of coverage somewhere in the network.
And if I could just add to that, so what we're proposing too is an enhancement on an existing concept. So we sort of have a fly car system now, and that many of the volunteer fire departments run a rescue. And what I mean by that is they'll have volunteer firefighters go in advance of a transport agency to render rapid care for somebody experiencing a life-threatening injury or medical emergency. So we're really just taking what we currently have here in Tompkins County already and enhancing that by having something a little bit more consistent that doesn't necessarily have to rely on the volunteer system to make it work.
Okay. Somebody else said something?
So you would basically eliminate the volunteer system or just?
Nope. That's a great question. No, absolutely not. I think that's the charm of this. We would be enhancing it by augmenting what they're doing. So if the fire departments are so capable of deploying their version of rapid response or their rescue, then that's just makes our system better. But this would be in play for when the fire departments couldn't necessarily do that. And I think that's part of what Mr. Lynch was touching on when he spoke in the beginning.
Okay.
And in particular, just to add to that, to Henry's question, and Mike, correct me if I'm wrong, or maybe even, I don't know if Justin's still on. I don't know, I'm not aware that any of our volunteer fire departments have the ability to regularly staff paramedics. And so it's that advanced life support level of care. It's the paramedic level response that puts the tremendous strain on the system, because that then will always default to one of the existing agencies. So if we can get a paramedic to volunteer at a fire company, we're thrilled. That generally doesn't happen. So it's that particular level of medical care that is what we're trying to target.
And you're correct. Most don't, especially at the volunteer level. Most are relying on EMTs, if not even a lower level, which is a more of a basic certification for that type of rapid medical response.
Okay, Lisa.
Yeah, I just wanted to thank you for the presentation and thank everyone who's been involved in this, and to say that in 2016, I was involved in the task force that met for the better part of a year or over a year on the same topic with Lee Shirtliff at the Department of Emergency Response. There was a SEPA study that was performed at that point, and it was at crisis level at that stage, and the situation is only exacerbated. So I know that there is certainly a need for this with the municipalities, and I'm interested to learn more. So thank you.
I guess I'll jump in with a comment. I think one of the first issues I encountered when I became a legislator, I talked with Irene Weiser about rural ambulance. And this was, while that study was going on and the problem was acute then, I've continued to follow it. I attended an ISAC conference presentation by Madison County on what they were trying to do was setting up their hybrid system. And I'm sitting here as a city legislator. My district is entirely in the city of Ithaca, but this is an issue where we really have to be one community. You cannot just say, well, that's the problem for those rural communities, because it impacts us all. And we will not be a strong county if we don't have strong rural ambulance. So I'm firmly in favor of us exploring this. I am very much cognizant of cost and the logistics, to Mike's question of where does this sit? And I would not want to build something from the ground up at the county for a fly car to sit in, but I'm sure there's some innovative ways to do this. I also would like to make sure that we don't lose any of the volunteer capacity. I wouldn't want to see just a transfer. As everybody has said, this should be an enhancement. And years ago, when I was the town attorney for the town of Lansing, the ambulance service out there was dying at that time. And not only did they lose the service, but it hurt. It really was an injury to the community in not having strong ambulance service, because it was such a point of pride that they had it and then they didn't. If we could do something to significantly improve this service across all of our towns, I would think that would be a really proud moment if we can get there. So I welcome further discussion on this. Again, we got to pay attention to cost. It's a service that the county has not historically participated in. So there's a stretch there to get to that discussion and saying we should be at that table, but I really think we should be. So let's talk a little bit about, what do you see as next steps? How do we proceed from here? What do you want us to do?
Mike, you or me?
Go ahead.
I would suggest, if it were up to me, I would suggest that the county legislature consider, and I know you're deep into your budget, but consider allocating funds for the director of DOER to potentially hire an individual. We'll call them an EMS coordinator. That is something that is likely to come out of Albany in terms of legislation. Fire coordinators are mandated. Albany wants to make EMS coordinators mandated if we go down this road. And at least start, being cost conscious, start with one item. And in this particular case, and certainly Mike, if I'm way off base, correct me, but having an individual whose job it is to figure out all of the logistics in getting this type of service launched, with a target of, say, optimistically, calendar 2024. It's not going to help us this weekend when there are a number of calls and we're at capacity across the county. But long term, it will certainly be the fix to the overall surge problem. But we do need an individual who can really make it their mandate. Not dissimilar, frankly, to the role that Mona's playing on the reimagining side. You have an individual whose job it is to determine, how do we implement this thing? What's it going to cost? What are the best ways to go about it? To me, to my way of thinking administratively, that would be the correct way to go.
Michael, do you agree with that?
I do. I think that if we're going to embrace it, I think that would be a wise next step.
Okay. Lisa, what do you think?
I agree, and I would be happy to have some further discussion around it.
Okay, I think that would be really useful. Perhaps we could have a proposal before us at our next Public Safety Committee meeting, if that's possible, with some sense of what the cost for this position would be. And perhaps we could push it into our budget as an OTR. Would this be a permanent position, or would it be to facilitate getting us to a fly car model? Or would this be ongoing? Is that the idea?
I think it could be ongoing. I also think, depending on how we structured it, that this individual could maybe even staff a fly car. I don't know necessarily that it has to be, a behind a desk manager's position. And so as we move forward, it could be somebody that's, has a very boots on the ground responsibility.
I'd love to hear comment from other committee members on this idea. Veronica.
Sorry, I like that idea, but I had two questions. One kind of related. Did you say, Mayor Hart, maybe that fire coordinator was mandated by the state?
I believe fire coordinator is mandated as a position under DOER.
Do we have one?
We do. So Justin Van is our fire coordinator, and Jessica Vervis, our deputy director, is our deputy fire coordinator. But Justin serves a broader role. Now, Justin is not an EMT, but he does serve right now in sort of a dual capacity in that he serves as a liaison to both of those emergency services communities.
And in the chat, Jessica is citing Municipal Law 209. Got another question or comment?
Yeah, but it wasn't quite on this topic.
Let's finish this topic of if we can, of adding an EMS coordinator position. Henry, did you have something?
And with the state, in terms of its looking at this issue, would they require an EMS coordinator, possibly through the pass down to the counties?
That is what came out of my conversations with Senator Hinchy on Tuesday, that the belief that in order to truly mandate that EMS services be provided, you would need some level of coordination at the local or regional level to make sure that it's in fact being done. And so we have a fire coordinator that's a county responsibility. And so it was, certainly there's no bill that's been written yet, but the thought that came out of the conversation was that the easiest way, rather than creating brand new mandates out of thin air that have never been done before, is to use the fire coordinator model, create that same type of position for EMS, and then delegate that to the counties. So if that is successful, then yes, it will be a required position.
And it would be required for the county to pay for it.
Which actually is part of why I think it works well with Assemblymember Kellis's efforts to create funding from the state as well. So there'll be a need to offset some of these things to bolster the network.
Henry, what do you think?
I think it's a good idea. I'm just want to see what the funding is.
Yeah. Okay, Mike.
I just want to say that as we do this, we already know that this is inside county baseball kind of thing. We put it in as a shared service now, as opposed to doing it and then later on saying, "Hey, look at what we did, so good." And because we've done that before, we've gotten out ahead of our skis, and then later on they ask for shared services, and we're like, "Oh, yeah, we've been
they
doing
say
that
you
for
already
the
did
last-"
it. Yeah, that one doesn't count.
So I'm just wondering if maybe there's a way to put it in early, or like, "Hey, this is a shared service we're thinking about doing."
But Lisa, maybe you could check on that. Yeah.
Unfortunately, we submitted a plan to the state saying we did not anticipate shared services for 2023. We can.
Maybe it could be amended.
Yeah, we can look into it.
Okay. But Travis and Mike, what do you think of this idea of an EMS coordinator?
I like the idea, and I like the idea that I liked kind of what Rory was saying was, why reinvent the wheel? I mean, we have a model for it, a model that works. So why not kind of go with that model with the fire coordinators?
Okay. Veronica, you had something else. Let's let you go.
Oh, yes. I just saw Dan Cornell put something in the chat a while back that looked interesting. Can you share out loud? About something about there should be a system for EMS to share.
Just rather than going out on these calls over and over and over again to the same people with the same issues that they're not designed to handle. I was just wondering if there is a way that we could develop a mechanism for EMS to make referrals to agencies that might be more appropriate and once those connections were made, potentially that would cut down on the frequent flyers need to call EMS because they'd have other resources available that would be meeting their needs.
Not to digress, but there's a New York Times article about a person with a mental health issue who made, I think over the last 4 years, maybe 2,000 calls for emergency services to a building that does not exist. And it has been a disaster for emergency services in Manhattan. Different problem, but yeah, if there's some way to address that, it would be really good.
I imagine there's HIPAA laws and other things that prevent disclosure, but seems like we're a resource-rich community that ought to be, 911 shouldn't be tasked with handling all these calls that are not a good utilization of their time.
Yes, Veronica.
I think that sounds like a great idea. I also wonder if it'd be like possible or helpful for like in a situation where 911 comes and maybe like whatever the situation is, they'd be like, oh, it would be great if we could refer them to blah, 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 but it doesn't exist. Or like, oh, we're taking this person to like the hospital in a mental health crisis, but we like kind of think that they're going to be discharged in an hour and still have problems. Keeping some kind of track. I don't know what this would look like, but like, this is what I would love. This doesn't exist, but this is what I would love to have for this person. And then maybe over time that could help inform like community services in the long term.
This has not been part of our discussion, but certainly part of our long-term planning here should be making sure that the cost of transportation is not critically high for people that just can't afford it. I know that it's an issue in some communities where they're calling Uber because they realize they can't afford to pay for an ambulance. We want to make sure it's affordable in our community. But I'm looking at trying to do clock management. This is a great conversation and I'd love to keep going, but we haven't heard from assigned counsel yet. And I'd like to get to that topic on our agenda. It does seem like we have a next step plan on this. Is there anything further that you want to say before we move off this? Michael, Roden, Mark, Ben, Dan, did we cover the issue?
Yeah, I'll just say from this end of the county, thank you, everybody, the members of the legislature. I think that this is something in my 15 years on the village board, this is something that I've seen evolve. I know Ben has in his time on the village board. We've seen this. I think Ben called it once a slow motion crisis. It's not so slow motion anymore. And so I'm glad, I'm thrilled that you all recognize that. And I think this next step will be a good one to let us know, what we're getting into and how to proceed. So thank you.
Okay, thank you. And thanks for all your work on this. Good. Let's move on. Lance Salisbury is with us and can tell us about assigned counsel. Welcome, Lance.
I can, hello again, everyone. I can be very quick. Nothing really new to report, Rich. We're kind of continuing on as we have been. So no new dramatic changes or developments here. So our new program coordinator, of course, has been in place, has been hired and has been in place for a few weeks. I think many of you have met her, Susan Tosto, now for a few weeks since my last report to the committee, but that's our only big change.
Okay. And I understand the rates issue is ongoing.
It is. I mean, we have a increased number of enhanced rate orders being signed by judges at the county court, in family court level. But I think we'll stay within our budget. Typically those are running $120 to $150 an hour. So it's the additional income right now, unless something changes, probably will be another somewhere between $60,000 and $100,000 cost to us for this year. But still, I think we'll stay at our budgetary limits, in our 2022 budget.
Okay. All right, thank you. Any questions, comments for assigned counsel? Right. Thank you, Lance. And is there any other business to come before the Public Safety Committee? Seeing none, I'd entertain a motion to adjourn. So moved, and all in favor? Show of hands. Thanks, everybody. We'll see you in a month.